It is a pleasure to be here. I was just commenting that I started in June of last year to visit frequently before my start, July 1st, so I'm nearly at a year. For some, that is very new, and I still have much to learn, but I have to say it's been an incredibly eventful year in many, many ways. First of all, I want to welcome you all. It's delightful that you're here, and it is something, we're in this period of celebration that happens around graduation, which really we do too little of. And one of the things that I'm going to beg your indulgence to give me a minute to introduce myself, since most of you don't know me. I immigrated from Portugal to New York and actually grew up here. I was on Staten Island, so it wasn't really Brooklyn, but I came through Brooklyn on my way to Stuyvesant when I wasn't going on the ferry. And New York is where my grandparents, who actually lived here, my mother was American, were based. And the public education that in New York has always been extraordinary. And I've had tremendous history of going to premier places, but nothing compared with my high school education here, or some of the things that I find really exciting about what we do. I was lucky enough to marry a person I met in college, who is now my partner in research for the last nearly 40 years. And we have been privileged to do work with populations. We do population genomics. We're both psychiatrists. Our children are sad about, no, they're not. They're doing very well, actually. But the bottom line is we've had the privilege to do some exciting things. Being Portuguese, our initial work were on the Portuguese islands, where we actually studied whole populations of patients with schizophrenia, with bipolar disorder, and all of their families. And then in the last 10 years, 15 years, we expanded that to a very diverse cohort of patient partners who we work with on an ongoing basis. And that group now is nearly 40,000 people, half of which suffer from psychiatric disorders, and half of which do not, and their family has no history of major psychiatric disorders. They all suffer everything else. Of course, many have diabetes, many have cancer. It's people, and what we study is human genomics. And we had the privilege in coming here, my wife actually is directing a new Institute for Genomic Health. Why health? Because the idea is our genome carries tremendous patterns that relate to risk, not necessarily program you for illness, but relate to risk of illness, but equally to patterns that program for resilience. So you could have full risk and never have a particular illness because you also contain the elements that protect you. So understanding both is a critical issue. And the population of Brooklyn is extremely unique. And so without continuing too much more on myself, let me talk a little about downstate. So I think you all know better than I that downstate has had a rich history of people who have made tremendous contributions in the scientific field, but also in terms of clinical leadership and health system leadership. I'm always amazed at what the graduates from downstate have done, how many are in academics, but also how many are in key leadership in terms of clinical delivery. It is really an extraordinary setting. But even more importantly, and tonight I'm coming to the dinner and I'm going to be sitting with one of the most important mentors in my life. And she and her husband, they're graduates from 1970. She and her husband both came from downstate. And I met her at Mass General, where I was doing my residency. And she was both, for my wife and I, one of our most important guides in terms of understanding what we could do in our specialty and how to do it. That, to me, speaks very personally, because when we see what downstate has gone through, which is a series of challenges over the last 5 years, the most amazing thing is the incredible quality of our students. They are phenomenal. They're doing incredibly well. They continue to graduate and go pretty much anywhere they want. And that is a true statement of quality in terms of our institution. I will tell you that the research program is one that is struggling, and I tend to be tremendously transparent. So I can make it sound a lot better than that, but it is struggling. Why? Because we're in an era that has been somewhat challenging in terms of funding. But more importantly, we're in an era of team science. We're in an era of strategic science. And so we need to define what downstate and our community needs and what role we can play on a national and international level. And in this era, what we have is an access to a tremendously important population, a population that is greatly underserved in terms of the research that helps us understand how to care for them. Our population in Brooklyn is tremendously diverse. It is a population that in the past has, because of racial and ethnic differences, not necessarily been participants in research. There's also been stigma to research in the history that has raised ethical concerns. And what that leaves us with is a population that suffers a major number of disparities in terms of their access to care, but at least one of them, or a very important aspect from my point of view, is how much we actually understand about the appropriate treatments and the nature of illness in those populations. So I think that we can actually play an incredibly important role in that, a role where we will be leaders in the national partnerships, the national networks of team science, because we provide a unique opportunity to partner for discovery in a way that will be directly applicable to the health outcomes in Brooklyn. I think that I will try to leave a little time for questions, or as much time as possible, but let me talk a little about what's happening in clinical care, because we know our missions are education, research, but really, incredibly importantly, the clinical health system that we are based in, that is our foundation, where our students and our researchers get to partner with our patients. And in health care right now, what we're seeing is a unique situation. We're seeing a very major transition in the way health care is delivered. And I will be, again, brutally frank. Right now, if we look at our major academic systems in New York, they are creating massive networks that are designed to provide a scale that allows for a value health proposition. What does that mean? I'm not sure I know what it means, but I think what we're really talking about is that healthcare finance is shifting from paying for an activity, paying for a procedure, to something which will reflect a demand on demonstrable quality, where outcomes become incredibly important, and where the system deals with managing risk, where health is the outcome that you're looking for rather than your ability to treat illness. For that, you need scale. So all of these systems, Mount Sinai, NYU, New York Presbyterian, so on, Northwell, expand to create that scale. But they do it from a business proposition point of view. In Brooklyn, what that means is there is a desirable part of our population. They are more affluent. They are likely to prefer to go to premier settings in Manhattan or elsewhere. And at the same time, they present a risk pattern that is less problematic. They tend to have had ongoing healthcare and be more participants in their healthcare. As such, what happens is the remaining population that we serve, that is our community, in some ways is now faced with greater disparities. And the hospitals and the health system that we are totally partnered with struggle to meet those needs. So to me, the challenge is extraordinarily interesting. It may be overwhelming, but I'm hoping not. And obviously, I was aware of it and came with that knowledge. I think we have an incredibly important role to play with a population that is both very deserving and very underserved. And so I think this is an extraordinary institution.